Let's bring in Dr. Perry Wilson, who's an associate professor of medicine at Yale University and up just for you this morning. So, Doctor, what do you feel that leaders really need to prioritize in order for schools physically to safely reopen?
Hi, Robin. Yeah, it's so important that schools get open. We're getting more and more data that shows that remote learning just isn't up to par with in-person learning, particularly for kids in the inner cities and in the more rural parts of the country where access to high-quality broadband isn't available. So how do you get those schools open? Well, in places where there's significant community spread of coronavirus, which, to be honest, right now is most of the United States, you need to set your priorities right. And I'll be very clear about this. In those types of places, you can probably have schools open or have restaurants and bars open, those indoor places where there's a lot of transmission, but you probably can't do both. And we need to start framing this as a choice to sort of protect our children, save our children. Let's support those businesses that need to have reduced capacity or move their patrons outside, ideally with some form of stimulus package. But these are tough choices. I think the kids come first.
So how does this one strike you? In Georgia, people who have tested positive for coronavirus or have symptoms are still going to be allowed to vote in person tomorrow. Thoughts?
Yeah, I mean, hey, happy Election Day Eve. You know, the right to vote is just so important. That everyone's vote gets counted is so important. But how can we do this as safely as possible? You know, I do want these people to be able to vote. It's critical that they wear masks. I would recommend, if you're quarantining but you're going to vote, try to get yourself an N95 or a KN95 mask, but if not possible, at least a 2-layer cloth mask to protect others as much as possible. We need a lot of hand sanitization before and after voting. We need really good social distancing. Most importantly, though, identify yourself to the poll workers early. Say you're quarantining and you're just there to vote. Ideally, they'll be able to get you in and out quickly, because we know that the shorter time that someone who has coronavirus is around is in an area, the lower the risk of transmission. So I think this can be done safely, but everyone just has to take a lot of responsibility here and do their part.
Okay, speaking of transmission here, a new study describes coronavirus spread in a household as quick. And the study suggests that you still isolate from other people in your home if you think you've been infected or exposed. How difficult is that, though, in the winter months?
Oh, yeah. I mean, it's difficult anytime. How do you isolate from your own family members? This was a CDC study just came out last week that showed they looked at people who were infected, and the rate of transmission to family members was about 50% within that first week that they were home isolating together. That is a high attack rate, as we call it. And this is tough. There are a couple things you can do to reduce that risk of transmission. Number one, wearing masks in the home in common areas, in the kitchen and areas where people might run into each other. The infected person really should isolate as much as possible. They should be in their room if they have their own room. They should use their own bathroom, a dedicated bathroom if that's possible within your house. But the most important thing here is if there's a high-risk member of the household, if there's an older adult or someone with one of the high-risk medical conditions, they need to be kept as far away from the infected person as possible. You know, opposite ends of the home if that's possible. They really shouldn't be coming into contact even in the common areas. And many of us would recommend that those high-risk people are really isolating themselves as much as possible. Now, this is not going to be possible for everyone. You know, not everyone has a home where they can do this. But nevertheless, you can reduce the risk. You're not going to make it zero. It's a bit of a scary situation, but a few simple steps can really take the edge off.
Dr. F. Perry Wilson, very good to see you. Thank you so much. Appreciate your visit this morning.